So, hello once again, guys. So, this is the continuation of our discussions on virology. So, this is DNA viruses, part one. Okay, so, the first in three parts. Okay, so uh, for starters, so the objectives or the learning outcomes for this discussion is that at the end, you're expected to be able to identify which viruses are DNA containing viruses and which are RNA containing viruses for you to be able to enumerate the different uh, families of viruses that are DNA viruses, okay? To differentiate them based on their characteristic strands, okay, as well as the type of infection that they are able to cause. Okay. So again, no, to review, our viruses will only either have RNA or DNA, but not both. Okay. So we have several members, family of viruses under DNA viruses. So we have the mnemonic HAP, those HHA, PPP. Okay, so or you can use the funny mnemonic Pol Papaagbo. Hey, okay. So Pol for polyoma, Pa, okay, for papilloma and Parvoviridae, Ad for adenoviridae, Po for Poxviridae, uh, He for hepadna, and He for herpes viridae. Yan. So, pili na lang kung saan dyan yung gusto nyo gamitin to memorize the families of DNA viruses. Okay? So, again, viruses can only either have DNA or RNA but not both because nga may mga ibang hindi kaya, no, na dalawa kasi ang liit-liit ng kanila. Maliit nga kasi ang ating mga viruses. They're measured by nanometers. Okay? So our DNA viruses are mostly double-stranded with the exception of Parvovirus because gamay kaayo si Parvovirus. So it will not be able to contain two strands. Okay? So huot na gani sa single strand. So kung double-stranded pa siya, wala na. Okay? So DNA viruses are mostly enveloped with the exception of parvo, polyoma, papilloma, and adenoviruses because those are naked viruses or they don't have envelopes. Okay, so first family under or first group of viruses under DNA viruses are the parvo viruses, no, or Parvoviridae. Okay, so these are naked single-stranded virus. They have the icosahedral type of capsid. They are, of course, the smallest. Okay, so they could measure from 18 to 26 nanometers, averaging at 22 nanometers. Transmission for the virus is usually through close contact or direct contact, or it could also be by inhaling contaminated airborne droplets. Okay, so the most common member for this group that is isolated in most labs is the Parvovirus B19. Now, this type of virus has a tropism for erythroid progenitor cells, especially in people with P antigen or the P blood group systems. Okay. Now, it can cause transient suppression of erythropoiesis. Later, I will show you why. So, masuppress ang erythropoiesis, which is the formation of your RBCs. Okay. Now, the infection cause is generally mild or asymptomatic, with the exception of in children with underlying conditions in their RBCs, no? Those that may have hemoglobinopathies like sickle cell anemia, okay? Or those with RBC disorders like hereditary spherocytosis. So the problem with those two cases is that abnormal na dati, no, yung kanilang RBCs. Okay? So sa sickle cell, yung shape ng kanyang RBC iba, no, sickle cell. So konting-konti lang yung oxygen. So if they are placed in an environment where oxygen is lacking or too limited, yung kanilang mga RBCs tend to change shape, right? Or ito namang may mga hereditary spherocytosis. So yung shape din naman ang problema. Okay? burot kaayo, no, lingin kaayo. So it makes it difficult for the cells to pass through really small blood vessels or capillaries, for example. If they do not have that disc shape that would allow them to squeeze themselves so they could enter small blood vessels. So wala yun sa may mga hereditary spherocytosis. So daling masira ang cells. Okay? So for those children na may mga ganong conditions, they may suffer from transient aplastic crisis. Okay? So transient aplastic crisis is a temporary cessation of red blood cell production sa bone marrow. Okay? And that could lead to severe anemia. Okay? So again, very common yan sa mga pasyenteng may mga hemoglobinopathies or RBC disorders. Okay? So infected yung cells nila, merong suppression ng erythropoiesis. Okay? And at the same time, yung remaining RBCs nila sa circulating blood, may problema pa talaga. Okay? So, ang ending nun, aplastic crisis ang mga pasyente natin. Okay? In immune-compromised patients, on the other hand, meron din siyang kakaibang effect. Okay? So, patients may develop severe and chronic anemia, yung mga pure RBC aplasias. Okay? Kasi yung immune system naman nila may problema talaga. Okay, so the infection cycle of the parvovirus B19 is that it would access the respiratory tract, okay, and then it is believed to either, replicate in the lung tissues, or it could just pass through the lung tissue, and then it would be directed towards the bone marrow, where it has been known to replicate rampantly. And then once it has replicated, virions may gain access into heart tissues, lung tissues, gut, liver, kidneys, because these sections or these parts has cells with receptor sites that are needed for attachment of the parvovirus B19. Okay. So this is the erythropoietic process. Okay, so this is how RBCs are formed. So we start with stem cells, multipotent hematopoietic cells, stem cells that would later on transform into myeloid progenitor cells, and myeloid progenitor cells would become the pronormoblasts. This pronormoblast would become the erythroblasts. Okay, and then the erythroblast would become the normoblast. Okay. And on its way to becoming reticulocytes, it would lose its nucleus. Okay. And eventually, the RBCs are formed. Now, looking at this cycle, you'll see that parvovirus B19 has an affinity or would attach to pronormoblasts. So they have a tropism for this particular cell. So if you notice, it's in the middle portion of the erythropoietic process. Okay. So the parvovirus B19 would infect proerythroblasts. This would cause the proerythroblasts to become engorged. It would enlarge as it fills up with virions. And later on, when the virions escape from the infected cells, it would cause the cells to undergo cell lysis or apoptosis. Okay. So this is why patients would experience anemia, okay? Because the infected cell is midway in the process of blood formation. Okay, so dito pa lang, nasira na. So it will not become, eto, or kung meron mang maiwan, konti na lang. So konting-konting RBC lang na produce pag na-invade yung proerythroblasts. Okay? So kaya nagkakaroon. So this condition doubles up if the patient has those underlying conditions like hereditary spherocytosis, or they have sickle cell anemia. So they have problems in production of RBCs because of this missing cell. And then at the same time, they have the underlying condition which would affect the shape of the RBCs. Either it could become too sensitive, like in hereditary spherocytosis, So magbuto-buto, inig mag-agi sila in small blood vessels, or it would change its shape whenever oxygen is lacking, like in sickle cell anemia. Okay? So may problema. Kaya meron sila nung transient aplastic anemia, no? For or transient aplastic crisis for kids with those underlying conditions. Okay. So what are the infections caused by Parvovirus B19? So the infection is called erythema infectiosum, or the fifth disease. Okay. As to why it's called the fifth disease, because very early on, it is believed to be the top five in the list of children's infections. Okay. So fifth disease ang tawag sa kanya. Okay. Uh, the characteristics of parvovirus infection or erythema infectiosum is the presence of a slapped cheek appearance, no? Kasi may rashes sa kanyang cheek na mukha siyang sinampal, gaya niyan, no? O, sinampal left and right. And then there are also rashes on the extremities, okay? Which would appear as if they are made up of lace, okay? So there's a characteristic lace-like rashes on the extremities. Kaya ito, no? Kaya may lace dyan sa picture natin. Kasi nagmumukhang lace daw yung mga rashes ng bata sa kanilang extremities if they have the fifth disease or erythema infectiosum. Okay? Now, this particular virus can also affect adults. However, if the adult infected is pregnant, that's a different story. So, it may result to hydrops fetalis or fetal death due to severe anemia. Okay. Usually, fetal death occurs before the 20th week of gestation. Okay. Now, although it has a 30% or higher intrauterine transmission, there is no evidence that this infection can cause physical abnormalities to the fetus. Okay. Now, parvovirus B19 is also known to cause joint involvement. So, because of the uh, production of excessive cytokines and excessive antibodies. Okay. Remember, if there's excess in cytokine production, that would lead to excess in antibody production, which would, cause the probability of interacting with endogenous tissues that may contain the same component as the antigen. Okay? So sobra-sobrang cytokines at antibody ang napoproduce. Ang tendency nun, pag nakakita siya ng mga components na kagaya nung sa virus, dito sa mga host cells natin, aatakihin nila yan. Okay? So they create immune complexes that would later on produce tissue damage. Okay? Then we have the Poxvirus. Okay, so the Poxvirus is enveloped, double-stranded viruses. They could be brick-shaped or ellipsoidal, okay, or rectangular. And of course, napaka-prominent nung kanyang dumbbell-shaped core. Ayan, di ba? Sa gitna. Klaro kayo. Okay? So the capsid is neither icosahedral or helical. Okay? Of course, they are one of the largest viruses, no? They could measure up until 300 nanometers. So pox viruses are of course known to produce lesions that may be filled up with fluids or pus later on. Okay, so human pathogens include variola or smallpox, vaccinia or cowpox, monkeypox, and Molluscum contagiosum. Okay, so smallpox or variola is transmitted via droplet transmission, usually through prolonged face-to-face contact. Dugay ka nagchismis, mga na tuloy na hawa, no? And then incubation period, this is really common for viral infections. Incubation period talaga is umaabot up until 2 weeks, no? So 10 to 14 days. Okay? Pag bacterial yan, shorter, nasa mga 2 to 3 days ang incubation period. Okay? So smallpox usually begins with a fever or starts with a fever, and the fever may run up until a week or at least 5 days. And once the fever subsides, that's the time that exanthems or rashes would appear. Okay? So, medyo mataas ang ating death rate, no? Or risk of death, around 30%. Those who survive, okay, usually are seen with deep-pitted scars, no? Naibuslot-buslot tungod sa mga lesions sa smallpox or variola. Ganyan ang lesion ng smallpox or variola. Ang lalapit, di ba? Parang wala ka nang mahulugan ng hairpin dyan dahil sa ah, kalalapit ng mga lesions. Parang nag-overreact na chickenpox. Okay? So, the rashes that we have or that we can observe in people with smallpox includes macule. Pag sinabing macule yan, flat lang yung rashes. They could be red. Okay? Red rashes, no? Parang may polka dots. Eventually, after a day or two, this macule will become raised, no? Signaling the separation of the first layer of the epidermis from the rest of the layers. They may be fluid-filled or some may just be empty, pero gamay pa mong siya kayo. Okay? Eventually, the papule would become vesicles. Here, no, mas lumaki siya ng konti at na-fill up na yan ng fluid. Okay? And after several days, the vesicle would become pustules. Okay? These are lesions that would contain pus. Okay? So macules appear the day that the fever would subside, no? So 0 to 1. After 2 to 3 days, papules appear. After 3 to 5 days, vesicles appear. After 6 to 12 days, pustules appear. And on the 13th day onwards, the lesions would start to dry up and form crusts. And eventually 21 to 28 days, the crust would eventually separate. Okay? So tignan natin, ano bang yung mga itsura? Ayan. So first, si Bebe dito ay merong macular rash. No, halos hindi natin makita pero kung titigan niyo mabuti, may mga ano dyan, naipuntik-puntik diha. Okay? So eventually, after 2 to 3 days, small papules would appear. Eto papules din yan. Okay? And then the papules here would later on become vesicles. And then the vesicles would eventually become pustules. Ayan, yung mga malalaki, pustules na yan. Ayan, no? So, pustules. And then, later on, okay, the pustules would dry up and they would start to crust over. And then, eventually, 21 days to 28 days, okay, so the crust starts to peel off and eventually, ganyan na yung maging itsura niya. Okay. It would heal. It would take some time, but it will heal. Eventually, those white patches there that you see would gain some color and parang later on, parang ano na lang yan, parang wala na lang. Unless medyo may deep scars yan. Okay? But otherwise, mahil din siya. Hindi na maklaro. Okay? So diagnosis and treatment is via electron microscopes. If you have that, that would be good. PCR, of course. Or you can do cytology and histology. Check out for Guarnieri bodies. So these are the eosinophilic, acidophilic structures that are stained there. So tissue sections, ganyan. Or you can do in vivo cultivation. So sa chick embryos, usually in the chorioallantoic membrane. Yan. So yung mga dots na nakikita nyo, those are the parang colony forming units ng ating viruses. Chick embryo. And then you have the cowpox virus. The cowpox virus is actually a zoonotic virus, but humans could acquire it if we live in close association with infected animals. And we can pass that to other people as well. Okay. But this is much like smallpox. Okay. But this is generally milder than smallpox. Okay, so very common ito in dairy maids or in people who come in contact with cows or people who milk cows because usually sa cows, ang lesions nakikita sa kanyang nipples or sa udders. Kung tawagin, ayan, udders. Okay? So, initially, nagkakaroon ng macule, papule, no? What else? Nagiging vesicle and then eventually nagiging pustules. Okay? And pustules would dry up at saka nagkakaroon ng mga crusts, no? And then later on, nababalatan din naman yan. Okay, so generally, the infection is localized and self-limiting. However, it's a different story for immune-compromised people. Okay, then we have vaccinia. So si vaccinia was once believed to be, or historically considered to be, one and the same with the virus that causes cowpox. Okay, now they're considered related na lang. Okay, they're not one and the same anymore. Okay, so the precise origin of vaccinia virus is unknown kay walay tarong record keeping during the old times. However, they know that vaccinia is can infect humans, monkeys, rabbits, and mice. Okay, then we have the monkeypox virus. So the monkeypox virus was first identified in monkeys, but it has been known that this virus can affect humans, especially those who are living in close association with contaminated or infected monkeys. Okay? So, pwedeng from monkey to people, people to people. Okay? Similar ang kanilang presentation with smallpox. So, na yung mga lesion, but this one is milder. Okay? Symptoms generally last for about 2 to 4 weeks. And then, nandun yung lymphadenopathy. Ayan, no? Nagsuswell ang lymph nodes. Okay? And then we have Molluscum contagiosum. So this one is caused by Molluscum contagiosum virus or the Molossypox virus. Okay, so it can be transmitted via contact, pwedeng direct or indirect contact. Okay, but the most common source are in barber shops. Okay, so barber shops, the common use of towels and clothes. Okay, so cytopathic effect, okay, are the Henderson-Patterson bodies or molluscum bodies. And so these are the lesions. No? They look like pearls. Okay, and so they can be found in the creases or crevices sa mga katawan natin. So pwedeng sa may kilikili, you can find that in the armpits, or you can find it in the antecubital fossa. Okay, so really small, dome shape, shiny, and they have the central dimple that you see here. Okay, sorry. Yeah, no. So bumps can become red or swollen, or they could be pus filled. Okay, so it's important really to be able to identify them early on. And sometimes, the skin around the lesion may appear to be dry and red, no? Parang may eczema lang. And then lastly, we have the human papillomavirus or HPV. So this one is naked double-stranded DNA with icosahedral capsid. They have a tropism for epithelial cells of the skin and mucous membranes. Okay? So, direct contact ang pasahan nito, ha? Oh, so the disease caused by your human papillomavirus are warts. Okay? So, kagaya niyan, di ba may kalunggo. Alam niyo kung wart? Kasi merong mga ganyan-ganyan once na na-expose siya, na-cut or na nail cutter, usual nail cutter. Yan, so may ganyan, no? So, different types of warts would include, ayan, seed and planter warts. Ayan, seed warts, no? Baka may seeds kasi. Madaling magpasa-pasa yan once na nagdugo. No? Ito mga planter warts. Ang dami, di ba? Ang bilis manganak ng warts. Or, pwede rin namang flatworts, gaya niya, no? Flatworts. Common ito sa mga matatanda. Parang ngayon ko lang nakita sa mga bata. And then, of course, di ba, good morning, hello. Mayroon tayong anogenital warts, or also known as the condyloma acuminata. So, ayan, no? Nasa penis yung kanyang genital warts. Or ito, okay? Hindi ko na malaman kung puwet ba to or vagina ba yan. Okay? Parang napakakulubot naman. Okay, so mukhang vagina naman siya. Yata. Okay, kasi nga may buhok dito. O, di syempre vagina talaga. Okay, so ayan, pero ang dami niyang palamuti. Ang daming warts. Okay. And our HPV is also known to be uh, associated with cervical cancers, penile cancers, pharyngeal cancers. Okay, so serotype 16 and 18, no, the HPV serotype 16 and 18 are the most common serotypes that is associated with cervical cancer. So this is the cervix. This is how the normal cervix would look like. This is CIN1 or CIN1. Ibang language lang kasi ito. Kaya baliktad. Nick. Okay. Parang Spanish. Okay. So this one is, in English, it's CIN, CIN1. CIN1 is, CIN means cervical squamous intraepithelial neoplasia. Okay. Pag CIN1 pa yan, low grade lang yan, no? Or may mild dysplasia. So I think you already know what dysplasia is. Okay. So ano pa yan, di ba? Parang pag dysplasia pa, reversible pa yung abnormalities dyan. Okay? Pero pag SIN2 na yan, medyo mataas-taas na level na yan. Pero tignan nyo naman, yung SIN1, parang halos magkamukha pa sila. Tsaka yung lesion, konting-konti pa. Sa 2 and 3, grabe na yung lesion, parang na-scrape off na yung epithelial lining. Okay? This is SIN3. Ayan. Diba? Dugo-duguan na yung itsura. And this one is invasive na talaga. Okay? Hindi na mukhang cervix. And so penile cancer is also associated with HPV. And so, ito mukhang lolo ng may-ari nito. Pero mukhang pare-pareho naman ang kanyang lesion, no? Parang ulcerated. Parang nabutasan yung skin sa kanyang penis. Okay? Ayaw lumipat. Okay. So, apart from cervix, penis, the anal region can also be affected. Okay. So here you'll see the lesions are graded as HSIL. Okay. So that is high grade squamous intraepithelial lesion. O high grade na yung changes sa squamous epithelium, iba na. Ayan. So ito, anal cancer na talaga to. Okay? And then of course, no, associated then with your HPV or laryngeal papillomatosis. Ayan, di ba? Ito mukhang normal pa pero kita niyo na tinutubuan na ng bukol. Ayan, may bukol, di ba? Ayan, grabe, mukhang may grapes sa lalamunan. I think grabe ng vibrato niyan. Kasi ang dami ng na ano, pwedeng bangga-banggain ng inyong sound waves. So the cytopathic effect associated with HPV are the coilocytes, no? So patients would demonstrate coilocytosis. Ayan, di ba? Yung mga epithelial cells na nabalutan ng vacuole yung kanilang nucleus. Ayan. Ito cervical smears. Ito tissue biopsy na yan talaga. Okay. So treatment, they may spontaneously disappear or meron namang pwede naman siyang pwedeng i-cauterize, pwede rin naman siyang cryotherapy. Okay. Pero medyo may kamahalan. Okay, so surgical or chemical removal for common warts, pwede. Okay, salicylic acid is a really good chemical remover for common warts. Okay, so prevention, avoid contact with infected person, umiwas sa mga contact sports kung pwede. Okay, of course, may vaccination na tayo for this. And you can perform pap smear. Okay, so for cytology and histology, you can perform pap smear which is ideal for cancer detection, especially for the cervix. Panoorin natin itong collection, no? Process for Papa Nicolau smear. Although hindi naman tayo ang nagpe-perform nito, OB-GYN. Ayan, di ba? So, kikilikitiin mo lang daw yung cervix. Ayan, swab. And then after swabbing, ito yung ano, tawag niyan, yung instrument na pinapasok natin para mag-dilate yung vaginal canal. So, may butas yan dyan. At dyan mo na ipapasok yung swab. After the swab, you can use brush or the Ayer spatula. A-Y-R-E, no? Ayer spatula. Mukhang bone ang Ayer spatula. Okay? Ito panoorin natin to. So this is the actual cervix, ah. Ayan. So papasok mo yung swab. After that, you do the Ayer spatula. Ayan. So ito, hindi ko lang talaga mahanap yung GIF niya, kaya nakaganyan. Okay. Anyway, this is the Ayer spatula. Para siyang chicken bone, no? Yung leg bone. Pero flattened. So yung dulo nun, parang yung sa bone talaga. Okay. And then, ini-scrape mo lang yan, palibot. Tapos, after that, you wipe or swipe the Ayer spatula on a clean glass slide, no? Para makolect mo yung in-scrape mo. Yan. So, pap smears. Meron tayong special stain, no? Papa Nicolau stain, which would make use of hematoxylin and Asin Azure, OG6. Okay? So, maraming pwedeng gamiting chemical. Or you can use the cytocolor. Okay? So, this is what normal pap smear would look like. On the other hand, this is how a so this is how an infected pap smear would look like, or yung may mga may mga malignancies na. So ganyan, acidophilic na sila. Okay? So cervical cancer screening may be done early. So sabi dito, age 20 or younger, no screening required, except if they are sexually active. Kailangan meron talaga. 21 to 29 years old, you can do pap test every 3 years. No HPV screening required, or needed. Pag 30 pataas, pap test every 3 years or a pap test plus HPV every 5 years. And then for those that are 66 or older, no screening needed if you've have 3 normal pap tests already, or at least 2 normal HPV tests in a row. Okay? So, that ends our part 1. Stay tuned for part 2 po. Salamat!